Now, there are only 3 hospitals in northern Gaza. The health ministry says the occupancy rate in these facilities reached 190%. Kamal Adwan Hospital is still treating patients, but doctors say the situation inside has reached catastrophic levels. Al-Awda Hospital is under siege by the Israeli army, resulting in the complete blockade of access to and from the medical facility. And the Indonesian Hospital is now out of service. Its director says the Israeli military has besieged the complex and is targeting anyone moving in its vicinity. Let's bring in Dr. James Smith, an emergency physician who recently returned from Gaza. He joins us now from London. Good to have you with us. So I understand you were in Gaza, you're in touch with people there. What's your understanding of what's become of, if we can call it, the medical service?
Sami, I think Hind articulated far better than I ever could the current situation. As she stressed, the hospitals in the north of Gaza, and in fact across the entirety of the Gaza Strip, are unable to provide even basic levels of care after more than 12 months of this escalated aggression. Kamal Adwan, the Indonesian Hospital, and Al-Awda in Jabalia have all been hit in recent days. They have been systematically deprived of basic medical equipment and also, importantly, fuel. We're aware of at least 2 patients at the Indonesian hospital who have died, who have been killed as a result of the deprivation of fuel that is required to run essential medical equipment. The fact that these hospitals remain open is a testament to the sheer determination.
The line that we often hear from Israeli officials is that they're allowing aid in. Just give us your perspective when you talk about the systematic denial of fuel and aid, of what you witnessed on the ground.
There hasn't been a single day since the 6th of October that the requisite amount of humanitarian assistance has entered into Gaza. And of course, needs have increased exponentially. I joined several convoys that attempted to move from the south of Gaza to the north. More often than not, we were denied access by the Israeli military, manning the checkpoints, now the de facto checkpoints in the Netzarim corridor. Very few of the UN convoys that have attempted to reach the north have reached. On occasion, aid trucks and fuel trucks had to turn back because there simply wasn't enough time to get to Gaza City and the north and back again. This also on occasion meant that we couldn't retrieve injured and sick patients from the north. I would categorically challenge any assertion made by the Israeli state and the Israeli military that they have provided adequate humanitarian assistance.
Well, the UN is talking about an unspeakable horror. We know that the north of Gaza has been under siege now for, 16 days, a total siege. And since I'm interested because you mentioned that you were actually on a convoy going from the south, trying to get into the north, the place that the UN says now is facing unspeakable horrors. Take us through that process. What happens? I know you said you were denied by the Israeli authorities. How does that take place? What do they say? Do they say, well, wait? Do they say simply you can't go in, or?
Several denials. As I say, I mean, somewhere in the region of about a quarter of the pre-approved convoys would ever actually make it to the north. There's a process of prior approval, so you have to get authorization now from the Israeli military to move pretty much anywhere inside Gaza. We would receive pre-approval. The teams would assemble in the morning, led by the UN. And these convoys would often include ambulances, as I say, intended to retrieve sick and injured patients, along with trucks of essential medical equipment, along with fuel. And then we would sit and wait some distance away from the Israeli checkpoints, awaiting what they call a green light to proceed. And on the majority of occasions, that approval would never materialize. We were often never given justification. And the teams at some point would simply have to return back to the south, back to Deir al-Balah, because there wasn't time to reach Gaza City and beyond.
All right, thank you for sharing your experience with us, Dr. James Smith from London.
Make sure to subscribe to our channel to get the latest news from Al Jazeera.